According to the report released by the South African Medical Association Journal, a stroke is the second leading cause of death after HIV/AIDS. Also, over 120 out of 100,000 people aged 35 years and younger die from strokes annually. However, a stroke is preventable. This may be achieved through the adoption of healthy behaviours and the management of stress. This morning in our Health Matters segment, we take a closer look at the hidden risks that are caused by different strokes affecting young people. Joining us to discuss this, Dr. Robyn Holgate, Emergency Medicine Manager at Mediclinic. It's great to have you, Dr. Holgate. Thank you very, very much for your time.
Thank you for having me.
You know, we keep hearing about people that are younger and younger having strokes. I mean, whether we talk about, you know, I suppose we can speak about well-known people because these are people that we can relate to in a way, whether it be Lyra, whether it be a former colleague of ours who did exceptionally well in financial broadcasting here at the SABC and elsewhere, Siki Mgabadeli. We're hearing reports of Deleuze as well, having these strokes at young ages. What is going on? Perhaps maybe you can break it down for us.
I think firstly to explain sort of what a stroke is and then to discuss it specifically in young people. So what a stroke really is that it's a brain attack. So in other words, it's something that blocks the blood supply to part of the brain or a blood vessel bursts. So it's your brain's equivalent of a heart attack. Now, damage to the brain from interruption of its blood supply is what happens, and a stroke occurs when that blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or it bursts. So there's two different types, ischemic and hemorrhagic strokes, and the ischemic stroke is inadequate blood supply, normally when there's a blood clot or a thrombus, and then the blockage disrupts the flow of oxygen. Hemorrhagic stroke, on the other hand, is rupture of a blood vessel. So in terms of young people, what we classically see is that the health conditions that cause stroke, firstly, most importantly, is that stroke is very common, more common than what we think in young people. So around 10 to 15% of strokes actually occur in children and adults under the age of 50.
Children. Well, let's talk about the children. Sorry, I'm gonna let you continue, but you say children? What age? What age would you look at?
Well, I think to put it into perspective, the most important thing that strokes occur in, the factor that causes that's most important that you can't change is in fact stroke in older aged people, so after 50. But the reality is that strokes can occur in adults and children under 50, and the causes are maybe not identical to the ones that we're classically used to, but there could be a stroke in a young individual from an injury which causes an arterial dissection in the neck, or alternatively could be congenital, for example, a congenital heart abnormality or a heart valve problem. And of course, there's all the lifestyle changes that we usually deal with in the older people that we're actually ignoring the impact of in younger children and adults.
Yeah.
And then again, also chronic disease.
Indeed.
So any of those factors.
So if I have to, I'm going to harp on the children part of it for just a little bit, because I mean we sort of look at people in the age bracket of their, you know, maybe 20s, 30s that are shocking us. Have you seen much younger children having strokes?
I think, as I've mentioned before, yes, there can be causes, and one of the most common ones is the congenital abnormalities and the chronic diseases. So the most important thing is to not underestimate the potential for a stroke.
Okay.
And to make sure, you know, I mean, medicine's evolved so much that we can in fact treat it much easier than what we did in the past. And we've got to make sure that people, even children and adults that present with strokes, in fact, do present to a hospital.
Yeah. All right. So, I mean, let's talk about how we can work to prevent it. I mean, lifestyle plays a massive role in all of this, and we do know that the stress levels in our lives are we're starting from a much younger age. Younger and younger, the stresses are just getting more and more and worse and worse. And this, of course, is something that leads to this. Besides the fact that our eating is bad, exercising, smoking, drinking, there's also drug abuse. I mean, there's so much that goes into it. Perhaps you want to talk to us about the factors that can influence our lives that can actually eventually lead to a stroke.
As I've mentioned, anyone can have a stroke at any age, but your chance of having a stroke increases with certain risk factors, some which we can manage and some that we can't. So high blood pressure of more than about 140/90, heart disease, and that's a very important risk factor for stroke, because, you may have then diabetes, smoking. Unfortunately, smoking doubles your risk for an ischemic stroke. Sometimes the previous history of having a stroke or a transient ischemic attack, which are called mini strokes, that can increase your chances of having a stroke by almost 10 times. High blood cholesterol, lipids, lack of exercise, obesity, excessive alcohol use. So in other words, if you drink more than 2 drinks a day, the reason for that is that it can raise your blood pressure, and that could cause a stroke. As you've mentioned, illegal drugs, IV intravenous drug abuse, because they may form blood clots, abnormal heart rhythms, for example, atrial fibrillation, very powerful and very treatable risk of strokes. Then any cardiac structural abnormalities. Of course, the one that you can't change is unfortunately age. And that sort of after around 55, your chances of having a stroke more than doubles.
Gee whiz. All right. I mean, that's something certainly to look out for as well, is for people to constantly get checked out. And then I'm going to ask you about that, but I just want to get back to some of the causes. And you were talking about smoking, and so many people have now thought, I don't smoke cigarettes anymore, I'm fine, I've turned to vaping. Talk to me about this, because obviously the risks are still there.
Absolutely. I think there's a lot still to be researched and investigated, but the risks are still the same at this stage.
Okay, so still the same. So that's important for people to hear this and to know that you're not necessarily out of the woods because you don't smoke a box of cigarettes, but you rather are vaping. Let's have a look at things where obviously we can now try and look after ourselves and ensure that we don't have a stroke. I mean, I suppose one would say if it's going to happen, it's going to happen, but we certainly can do things to prevent it. So what should we as individuals do? Regular health checks, obviously there are many things we can do. Perhaps you want to talk us through that.
I think choosing healthy foods and healthy drinks, choosing a healthy meal, snack options prevent, to help you prevent the stroke, keeping a healthy weight, getting regular physical exercise, not smoking, limiting alcohol, checking your cholesterol, controlling blood pressure, and also controlling diabetes. Those are some of the healthy lifestyle choices that you can make in terms of prevention.
What symptoms should we look for? Because a lot of the time, people may actually be at the point where they are having a stroke, but we don't necessarily know that they're having one. And this has happened. I mean, I hear that story all the time. What are the things we need to look out for? What do we do the moment we know someone is in fact having a stroke?
The signs can vary, obviously, according to where the stroke is in your brain. But, it could cause balance, eyesight changes, headaches, speech, and all those signs should be investigated. But what we usually refer to is the classic fast signs of a stroke. And those are, F is for facial drooping. If one side of the face is drooping and the other isn't, they may have suffered a stroke. Arms, if you can raise, does one arm drift downwards? If you can raise both arms, and then that may also be a sign. And then speech, the S in FAST stands for speech. Is the speech slurred or jumbled and mumbled and hard to understand. And then finally, the T is for time. So the time since onset and
visual
that's quite
problems.
important.
And
Yes.
visual problems, also not being able to see properly. I can see that on the screen at the moment.
Yes, correct. So on the screen, yes, visual problems, as I've mentioned, headaches, speech, the fast signs, facial drooping, arms, speech. Very important that somebody that has any of those signs does seek assistance from a healthcare practitioner.
How long have you got? I mean, if you are suffering with those symptoms, how long? Obviously, because this has to do with the brain, and I suppose the longer you leave it, the worse it gets. How long do you have to get that person medical help to try and assist them in any way you can?
And I think the most important thing is that we have to realize that stroke really is a medical emergency. Patients have to be taken to hospital immediately because the faster that we can manage strokes, there's potential for improved outcomes. So sadly, we're seeing our stroke patients present too late and then we can't intervene. So it's critical that we treat stroke as a medical emergency and we respond and transport somebody to a hospital as quickly as possible.
Yeah, obviously there's the, once you've been diagnosed with any of the symptoms, and I'm not talking the ones that you mentioned about, an unhealthy lifestyle or what you eat and drinking and those kind of things, but certainly, treating some of the other symptoms, whether it be the high cholesterols, whether it be diabetes or whatever the case may be, it tends to be very pricey and it's not really affordable for a lot of South Africans. How do we sort of go about these kind of things and look after ourselves in and amongst a very tough economic time?
I think a lot of the preventable stroke causes we can actually do without a financial incentive. So in other words, choosing healthy lifestyle, exercise, keeping a healthy weight, not smoking, limiting alcohol. So there's a lot of things that we can do in terms of prevention that don't cost a lot of money. And when we look at stroke, if somebody presents with a stroke, the reality is that the faster you present to hospital, the more cost effective it may be because you can look for the rehab may be faster, the treatment options could be delivered. So in fact, cost efficiency comes with presenting to hospital early.
Just a final question as we go, as we start wrapping up. Obviously, once you've had this, there is the rehabilitation, and that's what you spoke to. In terms of fully recovering from a stroke, what is the success rate? Is it possible?
I think that there's two things that we need to realize is that the transient ischemic attack, which is a temporary period of symptoms, which is similar to a stroke, often a mini stroke, those patients often don't have permanent damage. But a stroke really can cause permanent loss of function and brain damage. And then the long-term effects depend on which part of the brain is damaged. The impact can be, of course, long-lasting, but there's a number of factors that determine survival, and the treatment's important. The survival rate is obviously highest for those that are younger and lowest for those that are older. But we want it. The most important thing is that patients present early and then they have a good prognosis. Rehab, unfortunately, can take weeks, months, or even years. But very importantly, some people may recover from a stroke, but unfortunately, some people may never.
Yeah. All right. Thanks for talking to us about a very, very important issue. Dr. Robyn Holgate, she of course is an emergency medicine manager at Mediclinic, and talking to us about the very concerning cases of young people getting a stroke of late. But I don't think it's anything new, but it certainly is lifestyle related, things you need to keep on checking yourself out to ensure that you are not one of those that do unfortunately have a stroke.